What made me want to join Crossover is that this company looks at healthcare a little bit differently in a really positive way for patients, in a way that extends care for them and looks at more the preventative side of health and what is the best way to help keep people healthy instead of being reactionary and waiting until somebody is sick to help them out. I loved that there's an interdisciplinary team all under the same roof, which makes collaboration a lot easier in a team. It makes being able to provide more seamless care when I'm able to just stroll down and talk to their mental health professional or their chiropractor or their health coach, and just discuss what each of us might want to do for this patient within our respective positions. I do both in-office visits as well as virtual visits, and that just depends on whether or not the patient needs to be seen in person. Do we need to do a blood draw? If we don't, it's possible that patient can have a virtual visit, and that just extends care for them. If they don't have to come in and find parking, then they have choices and options. And so just makes it easier on the patient, and it just extends care for them. The collaboration in the team. I mean, this team, Crossover, does a phenomenal job of choosing people who are collaborative and who, are experts in their field. And so it's been really nice to be able to have all of this under one roof. I mean, it's just really not the typical experience to be able to just wander down to the office of somebody else on my team who is seeing somebody later in the afternoon that I saw in the morning. And it just provides a seamless experience in such a way that it's really nice to have that collaboration. Multiple examples. I mean, one from earlier today, I have a patient with a new diagnosis of prediabetes. And so this can be a tricky thing for somebody to understand that medications are not needed yet, but there are plenty of things that we can do about it. So I went and talked to the health coach, who is fantastic at being able to give specific recommendations on diet and exercise and help set those goals with somebody. So she was sitting next to me. So I had a chance to tell her, I recommended that this person has a chance to see you. They're probably making an appointment within the next week. Here's what we talked about. And then she takes it from there and doesn't repeat the same things that I talked about. So what that allows her to do is to not waste time covering material that has already been explored. And so she knows a little bit better what to focus on with that person, and already knows that this person is coming to see her and what they're coming to see her about. So here's another beautiful thing is we have point of care labs that come back right away. So our metabolic panel, lipid panel, and then hemoglobin A1C, which is a measure of blood sugar, that comes back immediately within that visit. If it's an exam, if it's an annual exam. And then I have a chance to talk to that person about what's going on, what is or isn't normal. And then actually even during the annual exam, then we can adjust and make other plans depending on if something is abnormal too. In other settings where I've worked, the difficulty with not having continuity of care is I might ask that somebody sees a physical therapist, and then I never really know what happens to that person. I know very little about, I can get the physical therapy note. I just don't, lots of times you send them off and you don't exactly know what's going on with their health. The continuity of care here and being on a team and having everybody under one roof is such that it's really nice to be able to hand off a person, know the care that they got, and not only be able to read the note, but also be able to touch base with that person when you're sitting around at lunch, discussing, oh, how did that go, by the way? What did you discuss? Oh, they're coming back to see me next week. Okay, thanks.